Let's talk about peptic ulcer. Peptic ulcer is a breach or discontinuity in the mucosa of the stomach or duodenum that extends through muscularis mucosa. It is caused by the action of gastric acid and pepsin. These are the layers of GIT from lumen towards out. There's mucosa, submucosa, muscularis, and serosa. It is not a simple erosion of mucosa, there is also failure of mucosal defense. In peptic ulcer, these layers are breached. So, as we have established, peptic ulcer is a breach in mucosal lining of the stomach due to gastric acid and pepsin. Sites of peptic ulcer are duodenum, stomach, esophagus, jejunum. Duodenal ulcer being more common than gastric ulcer. Microscopically, 4 layers can be identified, maybe not in this poorly made diagram, but in real they can. There's superficial necrotic zone, which can be seen where there is a breach of mucosa, exudative layer which contains neutrophilic inflammatory infiltrate, granulation tissue that contains mononuclear leukocytes, zone of fibrosis containing a collagenous scar that forms the ulcer base. Causes of ulcer. First, H. pylori infection is associated with almost 90% of duodenal ulcers and almost 60 to 70% of gastric ulcers. It is associated with increased gastric acid secretion and reduced duodenal secretion of bicarbonate. It also breaks down mucus layer. NSAIDs cause inhibition of prostaglandins, which is bad because prostaglandins promote mucus and bicarbonate secretion and maintain epithelial cell turnover. They also directly irritate the mucosa. There is also stress, smoking, alcohol, and steroids. Smoking impairs blood flow to the mucosa, and alcohol is associated with injury to the mucosa. ZES, which is also Zollinger-Ellison syndrome, it is caused by a gastrin-secreting tumor, which leads to massive acid production and multiple ulcers. Clinical features of these are epigastric pain that goes away on food intake, on duodenal ulcer, or worsens with food with gastric ulcer, nausea, vomiting, belching, weight loss, or bloating. Complications of peptic ulcer could be perforation. Perforation is the most common complication of gastric ulcer. Bleeding is also very common. It can lead to iron deficiency anemia. Malignant transformation is rare, but it can happen. Treatment of peptic ulcer is done with the triple therapy, omeprazole, which is a proton pump inhibitor. It decreases acid secretion, amoxicillin, which treats H. pylori infection, clarithromycin, and metronidazole.